You might recall a little more than a month ago, our community, we all were shocked by the death of 23-month-old Javion Johnson. Today, Javion's mother and boyfriend have been charged in his death, and I know that the Denver Police Department and the district attorney are committed to ensuring justice in the name of Javion. This unfortunate reality is that all of us, from the city's safety net to our response as a community, could have done more to protect baby Javion. Back on that day, July 17th, I announced the formation of a safety net impact team. It's been this process that we have employed on a couple occasions now to help deal with critical incidents in our community, including the most recent rash of gang-initiated violence in our community. This team was charged with identifying a way to bridge gaps in the child welfare and safety net systems, to engage the community to help us understand what we can do better to support them, and to talk with residents about what we can do as a community to encourage people to report suspected child abuse or neglect and better protect our children from harm. I am pleased to tell you that the Child Safety Net Impact Team has been making steady progress toward a better and informed, better coordinated and informed community. I'm pleased with some of the recommendations they're going to bring forward, or have brought forward to me and briefed me on recently, and I am pleased today to update you on the progress. I'd like to ask our new Executive Director of the Department of Human Services, Don Morris, to come share more about the changes already underway and those to come in the near future. Don?
Thank you, Mr. Mayor, and thank all of the folks who have dedicated a lot of time, a lot of sacrifice to the meetings we've held so far, and we've been meeting fast and furious. 4 weeks ago, when we announced this safety impact team, we made a promise that working together, we were going to strengthen the child safety net to better protect Denver's children. The mayor's direction was clear, and the initial actions identified by the safety net impact team we are announcing today get to the heart of becoming a more informed and coordinated community that better supports our children and families, especially when they are in crisis. Working to improve awareness among our city workforce is one of the first recommendations of the impact team. Each day, hundreds of city employees from a wide variety of agencies see and interact with children and families. These employees need to know how to recognize when a family is struggling, and importantly, how to recognize when a child is in danger. Beginning immediately, all city agencies will identify employees who routinely work with children and families, and those employees will be required, at the mayor's directive, to take training to help them recognize and report concerns about child well-being. I'd like to thank our partners at Denver Parks and Recreation, who have stepped up to be the first team of employees to take the course. By the end of the year, all identified employees will be trained, and it will be required training for all future employees in those positions. The next impact team recommendation centers around improved visibility and partnerships with our schools. At the recommendation of the impact team, Denver Human Services is deploying social caseworkers in several Denver public school facilities. This gives Denver Human Services caseworkers the opportunity to get to know and interact with children and families outside of the child welfare system, with a goal toward providing them any support needed for healthy, happy families. With better coordination, we believe we can help improve the safety of our kids. This partnership will also help improve communications with our school partners and allows Denver Human Services to provide on-site expertise, training, and assistance to school employees. The impact team also recognized early that data has a story to tell, a very powerful story to tell. Around 93% of children who died from maltreatment in Colorado between 2012 and 2014 were age 5 or under. 93%. We know young children often can't articulate what's happening to them. So when we receive allegations of abuse involving a young child, our workers need to see and understand what is happening. Denver Human Services recognizes that through a single process shift, we could see and help more children under the age of 5. A new policy implemented recently in my department automatically deploys staff to investigate allegations of abuse or neglect when children under age 5 are in a home and when the agency has received 2 or more referrals on the family in the previous 14 months. The goal is to improve child safety and to interact with the family to provide parenting support where needed. Another collaboration recommended by the Impact Team is a partnership between Human Services and Denver Health to bring medical expertise to the table as teams are making decisions about whether to investigate a child abuse claim where there are medical concerns. Members of the Denver Health medical team last week began consulting with Denver Human Services child welfare social caseworkers and other staff to provide this medical expertise, and we are already seeing results. Decisions are better informed, and we're able to provide a link to medical resources to assist families who don't need child welfare involvement. Another recommendation being implemented through the partnership between DHS and Denver Health is the development of a nurse home wellness program. Through this program, we can provide medical support to families referred to DHS who don't meet the criteria of an investigation but need extended health care support, which could include things like prenatal care and well checks for families with children up to age 5. But when it comes to kids and families, we know the best place to make an impact is in our community. Community is why the mayor created this effort, is to get more involvement. The Impact Team recognizes the need to better understand the community's views on how we can do more and how we can do better. To that end, we will convene a series of community conversations this fall to better understand the concerns of the community and explore ways the city can provide better support to families, children, and neighbors. The team will also be working with the Colorado Department of Human Services to place informational materials throughout the city about the new statewide child abuse and neglect hotline, 1-844-CO4-KIDS. 1-844-CO4-KIDS. But there is much, much more work to be done, and we must be sustained throughout ongoing discussion about how our children's safety net. To that end, the Impact Team has recommended, and the mayor has agreed, to the creation of a subcommittee under the direction of the Children's Cabinet to ensure ongoing monitoring and coordination of the city's child safety net and to oversee longer-term recommendations from the Impact Team. These are the first of what we expect will be many improvements in how we prevent child abuse or neglect from happening and how we respond when we believe a child is in danger. All of these efforts will help us ensure children are better protected in our city, but they are truly one small piece of this effort. Our community is our greatest asset. That means when you see or hear a child abuse or neglect, give us a call, even if you are not sure about the situation. A team of people will work to identify what is happening, provide families with the help they need to grow stronger, and we will take actions necessary to ensure a safe environment for children. And for our younger residents, tell someone you trust, like a school resource officer, a doctor, or a friend. Together, we all have a role to play in the growth and development and safety of our children. At this time, the Impact Team is happy to take some questions. Thank you, Mayor.
Jeff, did you have any comments? No, Mayor. Okay. All right. Why don't we open it up for question and answer?
How many caseworkers you have in schools, and how many schools will there be that have a caseworker in them?
Jeff, come introduce yourself.
How many caseworkers are going to be stationed in schools, and how many schools will be affected by that?
Well, first of all, let me introduce myself, Jeff Holliday, Deputy Director of Protection and Prevention Services for the Department of Human Services. Currently, we're looking at deploying 3 investigative social caseworkers into schools. We haven't fully identified all of the schools that they'll be deployed in yet, and we anticipate that those workers could serve multiple schools throughout the district as the need presents itself.
How will you decide which schools? Are you looking at youth numbers across the city, or how are you identifying?
So, John, as you know, one of the subcommittees of the impact team is a data and technology team. That team has done a tremendous job in identifying, over the course of the last 3 years in particular, referral volume across the city, especially with regard to what we would deem high-profile instances, egregious incidents, near fatalities and fatalities. And so we're relying on that data in cooperation with DPS to determine the best placement of those staff.
We have a shortage of caseworkers, and a number of caseworkers have been leaving the department. You're trying to get more caseworkers. You have a lot more younger caseworkers. How is this deployment to schools? How does this dovetail with the shortages, and how are you going to kind of justify that?
Let me take an initial crack at that, John. As we're looking at the whole department and our resources in this whole area, we are in fact talking about how we might add more resources in this area. But in the meantime, I think it's very helpful to be strategic about where we're putting folks, and when we really feel we want a community to be more responsive around these issues, we felt putting resources in schools in targeted areas would be a way to be sure we're keeping more eyes on the whole situation. So I just wanted to point out that we are and I am very mindful of the fact that staffing in this whole area is a conversation that I'm having. And in the meantime, I just want to have more eyes in the community, and I think in targeted schools will be a great place for them to be.
Sean? Since many of these cases, I understand, come to the attention of kids that have been known to DHS before, when you talk about expanding training to include more city employees, is there any additional training planned for DHS caseworkers, social workers, so that when these kids present themselves, that they identify them right away and not 6 visits or until it's too late?
Yes, great question. So the short answer is yes, and by the way, a couple of key revisions that both the mayor and Don spoke about. One has to do with revised protocols to require face-to-face contact, especially for children where we receive a referral where there are children 5 or younger in the home. That has already led to several more kids having face-to-face contact with trained social workers. Secondly, I think it's important to note the ongoing work that we've engaged Denver Health in. This is an area that Denver Health owns the medical expertise with respect to this type of work, and we look forward to our partnership with them and having them set in team decision-making meetings with us as we're deciding how to respond to referrals as they come in the future.
Let me also just say this, because I think it's a key piece. Standing behind this podium are people not only for Denver Human Services, but from the city's city attorney's office, Children's Affairs Division. We've had detailed conversation engagement with Denver Public Schools. Our Parks and Rec Department is here. What we recognize is that although we have an accountability as a county to respond where children are in danger, it is really becoming upon the entire community to keep our eyes and ears open and make sure people are trained to act when they see certain things that might indicate a child is in trouble. That's why Parks and Rec employees, as well as all city employees who have contact with young people, are going to go through training to identify and understand what to do, as well as the amending the protocols so that we engage faster and more often. So what we're trying to do is really do a collective call of the entire community to step up and engage. We have 100,000 kids, a little over 100,000 school-aged children in our city today, and we now know that we can 1 month see 50,000 of them come through our rec program. There's an opportunity right there for us to be more proactive and to identify the challenges early on and to make sure we're taking the steps necessary to protect them.
Don, question for you. The weakness that's been identified in the process has been over and over, at least the last 3 and probably the last 6 deaths, is that there's been a screen-out process. And it goes to a red team or goes to a group of people, and they simply miss the issue, i.e. in the case of Javion, THC, at the time of birth, no case still. What are you doing in terms of the workflow, in terms of that red team, and then after the red team identification or after the identification of the issues, is it now going to a second step? Is there now a group after that initial judgment that is reviewing this at the administrative level?
As I said, I think one of the great enhancers that we're announcing today to the system is to have the Denver Health people involved with the red team folks who are looking at this, and the red team folks are the ones who do the screening of which cases will be referred. You know, we're bringing more expertise to the table, and at the same time, there's no question I am asking my team how we can work better and smarter, and again, talking about potentially additional resources. But, you know, one thing I wanted to emphasize in response to your question as well as the prior question is we do have an amazingly talented, hardworking group of people at Human Services who really screen this stuff every day, and they do a great job. We're looking at it to try to make sure we're doing the best we can and trying to improve the way we do business. And a part of what we're announcing today is enhancing that system because, you know, we think that will improve our outcomes.
I get the Denver Health part. The other question, though, is beyond this decision-making that goes on, is there now administrators who are now reviewing that again to make sure that decision is correct?
John, I think I can answer your question. There are actually two additional levels of review. The key here is that we don't want to inappropriately screen out a referral that perhaps should have been screened in and had a response. So to that end, beyond the initial review of the red team, we have a group of child welfare managers that is also looking at those screen outs to re-review those to make sure that we haven't inappropriately screened out a referral. And then secondly, as you know, through your work, we maintain a quality assurance team that's separate from the child welfare division but embedded within our department, and we have engaged that team as well to conduct reviews on a representative sample of screen outs to provide additional information to the child welfare team so that they can make sure that to the extent that their protocols need to be revised or revamped, they have the information to do so.
So you said the two levels. Are you saying the quality assurance is one level and the administrative the other, or are there two? No,
those are the two levels that I'm speaking of. Yes.
Let me again thank you all for coming out this afternoon. This is be one of what we might do down the road, additional updates as we continue to fine-tune this. This impact team will continue to work as we fine-tune this process, but again, the ultimate goal is to protect our children in the city and county of Denver. Thank you all very much. Thank you.